Hi, I'm Kat McNaught and I am a pulmonary hypertension sufferer. I've been diagnosed about 4 years ago. It's been a long journey though. It's been more than the 4 years that I've known something was amiss, and I am currently on medication and I'm doing a lot better.
Can I ask, Kat, do you know what sort of pulmonary hypertension you actually have?
Yes, I have idiopathic pulmonary hypertension. So there's no, they can't figure out the cause of it.
Yeah, so no known cause.
No known cause.
Okay, and when you say you're on medications, can you tell us, I know the list is probably fairly long.
Yeah, so I'm basically on a triple therapy, which is an IV med, and they're all facilitators, so they're all opening up my arteries so that my oxygen can run through.
You have a pump that you wear on your body?
Yes, so that's a 24-hour thing. I've got to take it everywhere. Luckily it has a long line for showering, and so it's at this point I barely it's not really it's encumbering, no swimming kind of thing, but it's part of me now.
Yeah. And when they told you you may have to go on to the pump, was that a really scary feeling for you?
Yes, well, when I was first diagnosed, they did mention that was one of the things. Luckily, I got put on a trial, so I had about a year before I actually had to be put on the IV med, which kind of got my head around, that dauntingness of it, and I was pretty sick at that point, so anything that was going to make me feel better, I was willing to try.
Great. And how do you compare yourself now? Do you feel like that your life is a better quality of life being on these medications?
Yes, I was at the point that I was in actual heart failure, so I couldn't even walk a metre without being really breathless and struggling. It was very hard before I was on the medication, and it was at the stage where they were looking into transplant. So luckily they found out the medications would work for me, and it's been a gradual progress, but I'm at the stage where I'm actually quite, they don't want to put me on the transplant list because I'm too healthy for them now. So,
well, that's excellent, and that's the thing. So weighing it up, you prefer to have your pump and be on the medications,
yes,
and be in a situation where you're possible transplant.
There is lots of risk with the transplant, so I prefer to carry the machine around. Half the time I just forget it's there. It's just in my daily regime now.
Yep.
So that's my friend. I carry him around everywhere.
Have you got a name?
No, it's just my friend.
Just your friend. How has pulmonary hypertension affected your relationships with your friends?
So that was a bit hard because I went through about 2 years where I really couldn't really do much. So I lost a few friendships. All the good ones, they're stable and they stay stuck around, and I also got out there and socialised and told people my problem, and they're the ones that I've told, they're just fine with it. They just kind of consider me any other person. I'll let them know if I can't do anything or if I'm getting tired, and they're just, okay, well, we'll do something else.
Okay. So do you find when you go and have a consultation with your PH team or your nurses or your doctors that you have enough time to ask the questions you need to ask, or do you feel that you're like rushed and you can't sort of...
Well, with the nurses, they're really, really helpful.
Yeah.
I've got contacts that I can call whenever
So
I
you
want.
can phone a PH nurse if you're
Yes,
in
I
trouble?
can.
Yeah.
At any stage. Usually if I travel, for example, I went to Western Australia to see my sister.
Yep.
And my nurse is, here's a contact for over in Western Australia, just in case something goes wrong. They're at this hospital, you just have to go there. And unfortunately, I did have the case where I had to do that,
Yeah.
and it was all fine. We worked something out. The nurses on that side were very helpful. With the doctors, however, they're going to be rushed. You know,
Yeah.
they've got a lot of patients to see, but if you prepare any questions or whatever you've got beforehand, and they're usually quite happy to answer anything.
Do you find it's helpful for you to take someone with you, like another set of years, especially in the early stages?
In the early stages, I think it's really helpful to have someone who's by your side. You know, they don't have to, just the company, I think, because it is a hard thing to do if you're on your own. I luckily had my mother who came along a lot of the times. And she was a great support. I'm actually at home now with my mum, and she looks after me. And yeah, if I wanted to go to a meeting or anything like that, she usually comes. At this point in time, I've actually met a new boyfriend who's quite. And I just, it was one of those things. You know, it's a bit hard to tell someone about my pulmonary hypertension, but he was very understanding. And I think people are very adaptable to things like this. And now he comes along to all my meetings and things like that. So it's just good to have some sort of support, I think.
So you think that if you have a really good knowledge of the disease yourself and to be able to explain it to somebody else so they actually understand it, is a good bridge to...
Yeah, you're going to find people who don't understand, and I think you just need to not be too frustrated with that, because it's a hard thing to get, you know, it's hard for us to get our heads around it, so it's going to be harder for someone who's not in our shoes to understand. And I think you just got to actually have the knowledge to be able to explain it. And, you know, if you're getting pushed too hard, you just got to tell them. You know, you just got to say, no, you know, I can't, because, you know, the side effects, or because I'm feeling tired, and because people will forget, because they live a normal life, so they're not in your shoes, and, you know,
and I can't see your pump or anything, so it's an invisible disease.
You rarely see my pump. And when you do, it's in a little bag. It's a bit ratty-tatty at the moment because it goes everywhere. So that's all it is. And I just have that either strapped on my side or in my handbag, so you don't visibly see. You might see a cord. A few people just kind of think it's headphones, you know, from an iPod or something like that. Yeah, just never kind of clicked what it was. I had some people go, oh, you've got a tail. It's hanging out. And when I forgot to tuck it up, I'm like, oh yeah, that's just my machine. It's okay. And they're like, and then it's the whole explanation of a machine. What does this do, and why do you need that? And I'm all happy to explain it, because I think the more that know, the better.
Yeah, exactly. Yeah. And do you think Pulmonary Hypertension Association Australia, our patient organisation, has helped you at all?
Yes, a lot actually. I've logged in and had weird questions just to ask the people on the site, you know, and it's good to see other people's things, because sometimes, you know, I just browse and some will have like a question. I'll be like, yeah, I wanted to know that too, you know, I want to see the answers. So I'll have a look at the answers and I'm like, oh, okay, you know, I can relate to that. Because we're all different, but sometimes we have common kind of
crossovers.
Yeah, like things that happen with our machines, you know, if there's a glitch in it or, you know, and it's good to know because then if I come across that problem, I've got kind of a solution of what I can or, you know, should do.
Yeah, well that's great. And can you think of anything else that PHAA can be doing or can you think of anything more that we could be doing at the moment?
I think you guys are actually doing a really great job. You're getting it out there, and that's what it is. It's the unknown. Like a lot of people do not know. I actually have been a sufferer for years, and I was only found when I actually went into heart failure and nearly died from it. And I was turned away from hospitals when I was in heart failure because of my history, being that I was diagnosed as asthmatic and also having like panic attacks and stuff. So they've seen my history and they didn't even just check my heart. They didn't even, because I was so young, 27 at the time, they didn't even look at my heart. They just thought, okay, here's their history, let's go by that. And oh, you're having a panic attack when I was having severe heart palpitations. So, yeah.
All right, well thanks for that today, Kat. I'm sure that'll help a lot of people out there, especially our family, our PH family. I know it's brave of you to do this and we really appreciate it. Thank you very much.
Thank you very much.